I am very excited to interview today's guest, who happens to be one of my staff. And, her name is Tracy Farrell, and we are going to be chatting about testing for triggers. And so let me go ahead and dive into Tracy's bio. She has more than 20 years of experience in healthcare, starting on the administration side, working as director of children's hospitals with the think tank on women's and children's health, and then as a functional diagnostic nutrition practitioner and integrative health and nutrition coach at Natural Endocrine Solutions. And she did her undergraduate at St. John's University and also received a postgraduate research certificate from Adelphi University. And thank you so much for joining us, Tracy.
Thank you for having me.
Very excited to chat with you. And yeah, Tracy does an amazing job going over tests, and also she's done health coaching. And so just again, really, but we're going to focus here on the testing side. And so why don't we start off by, if you could just talk a little bit about your background. Why did you decide to become a health coach and then go on and become a FDN practitioner?
Okay, so I think like many people who do what we do, is it's usually a health event for ourselves or our family. For me, it was, I probably started really young. A lot of my parents' friends were activists and health-focused people. And then my oldest had a diagnosis of we didn't know. And they wanted to give him medication and they wanted to do things. And I'm like, okay, I'm happy to do what we need to do, but why not find out what's wrong with him? It turned out he had a little bit of ADHD and a little bit of dyslexia, not necessarily an appropriate use of pharmaceuticals, in my opinion, for a kid under 10. And I started at that point focusing on what can I do in a natural, healthy way to support him and to support our family. And that started me on my journey this way. And then years later, I guess I finally pulled the trigger of going back and getting my degrees and certificates in functional health and everything. And since then, it's made a huge difference in my family's health, from my oldest to my parents to myself. So that's how I got in it.
All right, wonderful. Well, thanks for sharing that. And as far as testing, so we'll of course talk about the different tests we do, and I know there's overlap when it comes to the ones that you learn about, but can you talk about what they taught you, like as far as like what tests they covered during your FDN training?
Yeah, absolutely. It's a little bit different today. They've updated their tests, as I'm sure, I don't know, Reed, I know you did an interview with Reed, so he'll probably update those tests for you. But on myself, I did, since I did it a little while ago, I did a comprehensive stool panel was our training, adrenal saliva test, which is the adrenal stress test. It's hair and mineral analysis, organic acids, and the MRI testing, which is a food sensitivity test.
You mean MRT? I think you said MRI.
MRT. I'm sorry, MRT. Excuse me. An MRI is totally different. Postgraduate, I've since added the dried urine test, which is the Dutch test, a functional blood chemistry analysis certificate. I did an advanced gut health course, a SIBO certificate and update just this year. Neurotransmitter testing and remediation, and a Zoomer for both the gluten, the wheat Zoomer, and a histamine. So I wanted to be, I like to be as updated as possible. And then I took a DNA course on sensitivities and other testing. I'm just in the middle of that right now. I clearly like school.
Well, and so what are some of your favorite tests? If you had to pick whatever, 2, 3, 4 tests, what do you really enjoy?
I'm sure, as you know, I love gut health. That's one of my favorite things. And interestingly enough, I didn't start off as being a big testing person. I thought to myself, well, as long as we change food and stuff. But the more that I dig in and the more that I do FDN, I have to say, The gut health I probably do it way too much on a personal level, but I love to see it in patients just because I find the field of microbiome and how it affects people and how it has so many different gut brain, gut thyroid, gut, has so many different effects. I've recently sort of fallen in love a little bit with the Dutch test, probably because I'm slightly middle-aged and I like to check my hormones and I like to see everything and I get to see how valuable it is for our patients. Organic acids is nice, and I have to admit, I used to roll my eyes at the food sensitivity testing because I felt that like our immune patients and all their health, they're so sensitive to everything that everything shows up. But the MRT testing, I'm sort of starting to really enjoy and see how it works and seeing a value for our patients in that more just from this is where you're at now standpoint. So that's sort of, that new test is starting to become something that I'm looking at a little bit more for our patients. I hope that ends. Yeah.
All right. Well, so what I like to do is just go down the list of some of the different tests that we do, in our practice, and just, if you could talk about some of the things you're looking for, I definitely could jump in as well. We could kind of go back and forth. This way, I'm sure there are some listening to this who, are familiar with these tests, but then there are others who have no idea, what's included with which I look for when doing an adrenal saliva test or a Dutch test or hair mineral analysis or comprehensive stool panel. So if you're okay with it, why don't we start with adrenal saliva test? So what are some of the things that you look for when we do an adrenal saliva test?
Okay, so I'll tell you a little bit, like a quick thing about what is an adrenal saliva test. It's done during the course of a day. It's a saliva test, as the name suggests. It's looking at your adrenals, and we call it an adrenal stress index, I think is the one that we use, and it measures the circadian rhythm of your cortisol levels. This test has you begin in the morning when you wake up, and you go all the way through the evening. A challenge for me when doing this test was not having coffee, I will admit that, and possibly an avocado. So make sure you read the directions, and no exercising. So those are a few things just to be aware of when you get it. What I'm looking at this is I particularly like this for the circadian rhythm of your cortisol levels. Frequently, as our thyroid patients are, as I probably all of them who've spoken to me can tell you, I'm always talking about the HPA axis and how things are tied together, sort of like teenage lemmings following each other, and how our hormones are interconnected. And when you have what I like about it is that you have a measuring of this so that we can see a snapshot of the stress in your life and how it's affecting you. And it's, looking at everything throughout the day versus like a blood test, which is just a snapshot of that moment in time and can be affected by what's known as, medical office stress. So I particularly like the adrenal stress saliva test for that. It's a nice snapshot into it. It tells us, captures, you could have food infections, what your possible triggers are, where you are, why you're having trouble sleeping. So I like that.
Yeah, I agree. As Tracy mentioned, so, there's different companies out there, and, the company we use not only looks at the circadian rhythm of cortisol. So cortisol should be at the highest in the morning and it should gradually decrease throughout the day. So that's what ideally we're looking for.
Call it a ski slump.
Exactly. So it also looks at DHEA, looks at 17-hydroxyprogesterone, looks at secretory IgA, which lines it lines the mucosal surfaces of the body, including the gastrointestinal tract, as well as respiratory system and other areas. But it's a form of protection, and it has a few other markers. Looks at insulin, gliadin. I don't do that test for that purpose. Really, it's the circadian rhythm of cortisol, DHEA. I do like that it includes a circadian rhythm. And yeah, well, like when I dealt with Graves' disease, my cortisol was flatline. Everything was low, or at least the first two morning cortisol. Really, you want those to be the highest, especially that first one. The second and third, it's supposed to be on the lower side, especially that the last one, or the third and fourth one should be on the lower side. But my first one and the second one was definitely low. And then some people have the opposite, where their cortisol is high, and we're trying to do things to to calm down, the adrenals. And,
Right.
Tracy mentioned HPA axis, which is the hypothalamic pituitary adrenal axis. So hypothalamus communicates with the pituitary, that communicates to the adrenals, and that tends to get dysregulated. So we're doing things like stress management, mind body medicine, adaptogenic herbs, to help support that HPA axis. But yeah, I agree. I've been doing this test for, recommending it for, I guess I've been in remission since 2009. So since then, I've been recommending to patients. And now in some cases, we'll recommend Dutch testing, which is the next test I want to discuss, because Dutch
Yeah.
test also looks at adrenals, but it looks at a lot of other things as well. So what are you looking at, Tracy, when we do a Dutch test?
Excellent. A little bit about the Dutch test, because I'm going to introduce them each time just to annoy. It's dried urine testing is a Dutch test. I feel like I say this about all the tests. Oh, it's easy to do with all of our tests. And in a lot of ways, all of our tests are easy in the sense that you are doing them at home. So it's easy to do a lot more on the road. I did my own Dutch test between travels recently. So it's another take anywhere test. You don't have to go somewhere special. You just order it and it comes, which is nice. So this test utilizes urine to analyze your sex and adrenal hormones and their metabolites. And, you're going to get little strips with it, and they have, you're going to pee on them several times a day. And, for some people, this test is easier than the adrenal stress index, the saliva one, because some people can't produce enough saliva. I like to say in my house, the saliva one was a little bit difficult for my husband. I guess I'm a little bit more salivary than he is, and I found that one easier versus the Dutch test. I found a little bit harder for me because I hydrate a lot. So one of the things, as I mentioned with the ASI, you'll have to be aware of is they like to have you a little restricted on your water. I think it's 44 ounces a day that you'll be limited to. So, for somebody who's hydrating properly, that's a little bit annoying, but that's the worst that I have to say about it. And so it's a good thing to be aware of and to know, but it was easy to use, and I really enjoyed getting it back, as Eric knows, because I put it right under his nose right when I got it. Some of the reasons why I like the ASI test, and you'll also like the adrenal stress. You're going to avoid caffeine, another hard thing, and exercise, and a couple of foods. You're going to look at that list. So it's just a good thing to know. I like what this test looks at. It looks at your sex hormones, estrogen, testosterone, androgens, and their metabolites. Your adrenal hormones, oxidative stress biomarker, and your organic acids, which is on an expanded test of this. And it can also look at, depending on which ones you order, you could add the cortisol morning with a spit. So, that's a little bit about the test. I have to say, as like a middle-aged woman, I kind of love the test for myself personally to get a snapshot. And for our patients, I love it for the metabolites. What I mean by metabolites is the usable hormones that are secreted in your urine. So that's what if I got that correct, Eric will correct me on that if I didn't. And this is the only test that does that. And as I mentioned earlier, our HPA axis is tied to it. And in our Graves patients, we frequently see, especially in women, hormone dysregulation. Men too, but women, we're just really grander in our hormones. We're more shouty. And I love the fact that this gives us that metabolites and what we can see in them. It forces us to see them, and it lets us, they're important for helping us diagnose certain conditions. You know, a good example of what kind of conditions they can help us for women, the estrogen and the phase 1 and phase 2 with the progesterone can show us, you know, fertility issues, confirm autoimmune issues. You're having some PMS, I could see where that's at. On the male side, you know, we can do some androgen metabolites, you know, got that male pattern baldness. You might want to, we could see what's going on there with that, some prostate issues, some both sides acne issues where we could check in that. And it helps tie it in to, you know, how we approach a treatment and how we do it. Like for when I was a health coach, I like to look this over and see, you know, I didn't have as much knowledge of like, you know, diet and lifestyle. What am I going to do for that? Here it might be, you know, making suggestions on, you know, estrogen regulation, and some of our patients are younger and they're looking to have children, and how we can maybe get that together and help them achieve their goals. So I really like that about it, the test.
Yeah, I agree. I like the Dutch test a lot. And just as Tracy mentioned, it also looks at the circadian rhythm of cortisol, just like the adrenal stress index test does, the ASI. And again, when it comes to triggers, because I didn't mention with the saliva test, specifically triggers, I mean, stress is a potential trigger. So when stress, you know, without question affects the adrenals, and you need to have healthy adrenals to have healthy sex hormones. So, you know, arguably, not everybody needs to test the sex hormones, which is why I don't recommend Dutch testing to every single person. I mean, it's not going to hurt for for everyone to get it, but it is more expensive than the saliva testing. And if we're just focusing on adrenals, I think saliva testing is sufficient. But if you do want to look deeper into the sex hormones, I mean, of course, you could also do blood testing for sex hormones. But as Tracy mentioned, a big advantage of Dutch testing is that it looks at the metabolites of the hormones, which you can't look at through the blood. You can't look at through the saliva. So the different metabolites, there's cortisol metabolites, androgen metabolites, but the main ones I focus on, not to say I don't look at the other ones, but I think the most important are the estrogen metabolites. There are 3 estrogen metabolites it looks at. And, you know, when talk about estrogen dominance, or I mean, estrogen dominance, you could have high estrogen levels, or you could have normal estrogen levels and low progesterone. But again, the blood testing, this, if someone does, you could do saliva testing for sex hormones as well. But again, you can't look at the metabolism of the hormones. And I've seen people with lower estrogen levels, yet they have higher 4-hydroxy or higher 16-hydroxy metabolites, which are the so-called bad metabolites. And nothing's really good and bad. You just don't want too many. I mean, you want everything to be within a healthy range. And again, this could be estrogen dominance, or problems with estrogen metabolism could be a potential trigger, or at least a contributing factor. Also, if someone has thyroid nodules or uterine fibroids or ovarian cysts, that could also be a factor. And so, I don't think everybody necessarily needs to do this test, but for those willing to do it, it is very valuable. Like if someone has a history, you know, like if they have a history of fibroids, or I mean, a lot of people have thyroid nodules. So I can't say I have everybody do the Dutch test who have thyroid nodules, but if they have a lot of different conditions related to problems with estrogen metabolism, so if they have not only nodules but also, again, the fibroids, ovarian cyst, endometriosis, you know, then that might be an indication to do the Dutch test. Or as Tracy mentioned, if they're having like fertility problems, that's another good reason to do the Dutch test. If there's a family history of estrogen dependent cancers, or personal history of estrogen dependent cancers like breast cancer or certain breast cancers, then again, it probably is a good idea to consider doing the Dutch test. And she also mentioned it as a section where it looks at organic acids. More on the basic side, we're going to talk about more comprehensive organic acids test. But still, it is kind of cool that it looks at some of the organic acids related to glutathione and related to some of the the B vitamins, B12 and B6, and some oxidative stress markers. So yeah, I mean, you do get a lot of information with the Dutch test. Melatonin also tests for melatonin as well. So yeah, I can't say enough good things about the Dutch test.
Yeah. I also
And
like the oxidative stress marker, which I didn't appreciate as much until more recently from the, I guess, coming from more the nutrition end of it. I like to look at what it's 8-OHDG is the marker, I believe. And I like that one because it shows, like we talked about triggers, and it seems like a lot of them are stress, some estrogen. And this is a nice marker to show patients, oxidative stress, how it's affecting it gives a fuller picture to see how stress affects them on a cellular level. So, we've heard about DNA damage, generational DNA damage, but this is, showing you on your body. And I was like, oh yeah, I didn't appreciate that as much as I have recently, where I've been reading up on oxidative stress and how to combat it for things. So I thought that was interesting, and I forgot to mention that.
yeah, no, thanks for sharing that. Yeah, I agree. And also, it's probably a good idea to let people know too, like for women who are cycling, who are menstruating, you could do a cycle mapping, like a cycling
Yes.
hormone panel, where you could collect samples throughout your cycle, which is arguably more accurate than just doing a single sample, which most cycling women, they would do it in like the second half, the luteal
Yep.
phase. And again, that's better than nothing. I mean, a lot of doctors use that, but this is kind of cool that you can,
Yeah,
look at it throughout your whole cycle.
it is nice. It is. It is. I did not do that one. I couldn't give up coffee and exercise that long.
So let's talk a little bit about hair mineral analysis testing. So if
Sure.
you want to dive into that, and what is, what is it, and what do you look for when you do that test?
So this test can be a little more challenging in the sense of it's an easy at-home test, but then we have to cut our hair and not color it for a month. Some of us have more hair than others. We won't make it, so I always suggest to patients, hey, grow out your hair for a month, do the test, bring it to your barber or your hairdresser and let them take a little patch in the back so that you're not having some spouse, family member, friend take too much or too little. That's just my tip of the day. It is actually easy. I make it sound. So this test, it's valuable. And I have found it valuable with patients, but this is valuable because it gives us a snapshot of heavy metal exposure, which I love. It also gives us, it's like not perfect because it finds our heavy metal hidden and toxicity. And part of the reason why that is good is because our body is an extraordinarily efficient machine, even when we're sick. It detoxifies and pulls out all the things we're not supposed to have in our body, and it stores it in our tissues, in our hair, and our bones, and that's where it deposits them. So this can give us a non-invasive way of seeing how are you absorbing nutrients? Do you have any heavy metal exposure? Things like mercury and copper and aluminum, along with some trace minerals like zinc, selenium, magnesium, calcium, and others. So it's a nice snapshot, like things like the trace minerals. If you're telling me you're taking vitamins and I'm not seeing them in your hair being deposited, I'm like, what kind of gut issues are you having? Or are you not having it? Things like thyroid health, and we can confirm or eliminate copper toxicity, which is definitely a possible trigger. I am sure that Eric has seen this. I haven't personally seen this. I've seen other ones, but I know that copper toxicity is related to like estrogen production, and zinc and copper are kind of levers for each other. Speaking of heavy metals, for me, it's had a significant impact on our last, I think it's 2 challenges ago. There were 2 patients. One was a jeweler. And when I looked at her test, I was like, oh my God, this person's got lead poisoning. and it was really concerning. We were doing a group call, and I actually emailed them separately because it was the highest numbers I think that both of us had ever seen, because I asked you about it. It turns out she was soldering jewelry without protection. And not only was she infected with it, but her whole family was infected with lead poisoning. So I was like, oh, there you go. There's another thing. And, that's just one example. I had somebody worked at a mechanic shop. They owned a mechanic shop, and she had some poisoning toxicity and ended up remediating her whole shop and her whole group. So that's just two extremes, but it does show up on it. So I did mention copper toxicities, things like that can cause it, or pipes, cookware, industrial stuff, hormone replacement, copper IUDs. That's a whole other subject on female hormone replacement that I'm sure one day and you'll cover. Vegan diets, if you're smoking. So it's a really nice test to find those things, and thyroid and hormonal imbalances and mood and depression and weight gain and everything is all connected to this one simple small amount of hair test. So I didn't know that I liked it as much as I did till we did this talk.
Yeah, I like the hair test. Also been doing it for years, and it's not a perfect test. There is, some practitioners will, criticize the hair test, being that it's not perfect. And I admit it's not perfect for, like, you could have heavy metals deeply embedded in the tissues and not showing up. Same thing with urine testing. Some practitioners use urine testing for heavy metals, and same thing, that's not perfect either. Some practitioners use like what's called provoked testing, especially in the urine, where they'll do like a baseline urine test and then give like a provocation agent, a chelator, and to mobilize the metals, and then do another urine test. And there's controversy over that, as well. But when we see the metals, then we know that there's a problem. When we don't see the metals, that it doesn't completely rule out a problem. And sometimes we'll see where maybe we see a few things high initially. Someone, does things for detoxification. They'll retest a few months later, and some things that weren't high the first time are now high. And the reason for that is because, again, by detoxifying, a lot of times we'll release metals that were more deeply embedded in the tissues. And so it's not necessarily a bad thing. Ultimately, of course, you want to see everything start decreasing, and you'll probably never see zero across the board, just because we're always being exposed to heavy metals. But yeah, I like that test. And as far as minerals go, again, it's definitely not perfect with the minerals. Some of them I definitely pay attention to. Others, like iron, I usually don't pay as much attention to. I would not rely on iron in the hair test, which is why I recommend like a full iron panel through the blood. And if someone has like hard water, it definitely will spike up the calcium levels, so you got to keep that in mind. If someone is using anti-dandruff shampoo, usually it has selenium, so you might see elevated selenium. So again, you need to understand that that again, there are certain variables that can affect the minerals in that way and cause elevations. And then, as Tracy said, if there are other minerals where you see low, if there's a lot of them then that are low, then yeah, you might be suspecting a gut issue. And so yeah, it is a good test. It's inexpensive test, affordable for most people to do, not only initially, but the challenge with with testing in general is that when you find something, not everybody could afford to retest. And not, as a result, not everybody does retest. Like when I did my adrenal saliva test and I mentioned everything was low, a few months later, I did another test because I wanted to see and make sure that what I was doing was helping the adrenals. And you could go by symptoms improving, and maybe your thyroid test and see if they're improving. But I wanted to do another saliva test, but some people won't want to do another saliva test or another Dutch test or another comprehensive stool panel. And again, I'm not saying everybody has to do an initial test and then do a retest, but in some cases you would want to consider doing that. With hair, it's usually not a problem just because it is so cost effective.
Yep. Yeah, exactly.
Yeah. So next, maybe your favorite test. I know you mentioned earlier how much you like the stool test. So let's talk about the comprehensive stool panel. We use in our practice, we use the GI map. There are other really good stool tests like GIFX from Genova Diagnostics is really good, but we've been using the GI map from Diagnostic Solutions. Again, there's other companies as well. So, and I'm mentioning the name just because she's going to go over certain markers that might just apply to GI map. And I will, actually, I'll let you talk about the GI map and what you look for, and then I'll fill in the gaps if there's anything you
No,
don't.
definitely. There will be gaps. So the GI, the comprehensive stool panel, again, exactly what it sounds like. Sometimes I tell people my tip of the day is I learned from my youngest, who said she just spreads out something on the floor when she does it. Because, when you come to my house, I'm a nutritionist and I do functional diagnostic testing. So instead of a mint on your pillow, there might be some testing on your pillow. And instead of that, like if you're a family member, at home testing and experimentation is a real thing in my house. But I've trained on the DI map. I've trained on the Genova, the Cyrex, Nordic. What most people will know is what most people will be able to recognize about it would be it's a DNA based, the one that we use, quantitative PCR testing. You're most familiar with it by hearing the Cologuard, the colorectal. Instead of getting your colonoscopy, if you don't have a risk, you're going to poop, as I lovingly call it, poop in a box. And that's probably the most familiar that people are with it is the alternative colon cancer test, the little camera thing. So quantitative PCR just means instead of doing a long DNA testing and a long DNA test chain, it's a faster test that extrapolates more information, which we love because until recently in gut health, we could only see what was the aerobic, the oxygen breathing bacteria that survived when you poop it out. With this test, it was a game changer in gut health in that you can now get the DNA from the anaerobic, the non-oxygen breathing ones that aren't committing suicide the minute they get out of your body. And that has opened up the whole field of the microbiome. I tell people I've been interested in poop for far longer than it's been exciting. But as we know in recent studies, is we're seeing deficiencies in kids in the spectrum. We see deficiencies in people with colitis and SIBO and SIFO and thyroid health. We see those deficiencies, all immune and inflammatory diseases. We're seeing them because everybody's inflamed. So I obviously have a lot to say about this test. I like the ranges in the tests that we use. Instead of just a positive or a negative, we're getting an entire range of numbers. So I could see your secretary IgA, both you're getting it in your Dutch. Is it the Dutch? No, it's ASI. You get it in the ASI and you get it in this test. So what's interesting is it's a tremendous correlation for us between the two is that like, hey, my saliva in my upper tract is good, or in my lower tract, and we can correlate. So the tying in of the tests help. So I love to look at, all the markers. I probably first became familiar with it with, my testing here. I like to look at the H. pylori portion of it, which lets us know if it's too high, too low. It's the most comprehensive. It gives a range. It gives virulent factors. It lets us know, like, is it antibacterial resistant? Is it not? Again, the SIG IgA that we mentioned. There's parasite markers, which I've actually seen, which was interesting. I don't see them very often, but we had a patient who had claimed never to have gone out of the country, but was a florist and actually picked up a parasite from her floral deliveries from overseas that we had to treat. It's really fascinating. I can also tell what you're eating by what your poop tells me. And so if you're telling me you're being good and you're not, I can see in your opportunistic trigger markers. I could see in your, if you do the zonulin portion and your calprotein. So it's a nice snapshot if you can do. I mean, there's definitely other tests that will tell us more from a thyroid perspective, but I just happen to like it from an overall health perspective on it. And I can say that I probably do it too much in my household, but we all had H. pylori, and an interesting factoid about the H. pylori was how you react. And this is probably with most things, is the highest marker individual in my household did not have any symptoms. The lowest marker individual in my household already had some gastric markers from like GERD. They were already having some erosion in their stomach from possible ulcerations, and they were so this really helped us treat. And they too have thyroid issues, and this helped us treat it. So your symptoms and how you're feeling are going to base on what your markers are, and let me know how your snapshot is. So I don't know if I answered all the interesting things about it, but clearly I like a nice GI map.
Yeah, you covered most of the highlights. As you said, it's a quantitative PCR. So it's not just, like, for example, you mentioned H. pylori. If you go to just a regular lab, it's just going to say, are you positive? Are you negative? Here,
Right.
it'll actually put a number on it, unless if it's below detectable limits, and it'll be less than DL. But otherwise, it'll actually put a number. So like if someone is elevated and, so clearly positive, and then they follow either a natural protocol or if they take antibiotics, and then let's say they test after that protocol, and if H. pylori still is high, which would be a bummer, but it does happen,
Right.
you could see, well, did it get lower at least? Whereas if you went to a regular lab, you would just see it still positive maybe. And that's another advantage, is being that it's PCR, it does seem to be more sensitive than regular labs. So some
Yeah.
labs won't pick it up, whether it's a stool antigen or urea breath test, and where this will pick it up. And so again, yeah, I like this test. It also gives what's called virulence factors, which I'd say most of the time are negative, but I have seen, the other day I had someone who had 2 positive virulence factors, and what this means, they're just increased susceptibility to developing. It depends on the virulence factor, but some of them relate to like developing ulcers, which are correlated with sometimes with H. pylori, some gastric carcinoma, which of course is not good. But again,
Yes.
it doesn't mean if you have positive virulence factors, you're going to develop ulcers or gastric carcinoma. It's just an increased
Right.
susceptibility. So yeah, I like the H. pylori part on this test. With some other tests like Genova's GI effects, you have to add on the H. pylori, so it doesn't come with H. pylori. And then
Yeah.
I'm pretty sure it's just like the stool antigen. It's just like positive or negative through
Mhm.
that test. The parasites, yeah. So you mentioned parasites, which I will say Genova does have a little bit more within the parasite department on their test.
Right.
They give a little bit more information with the parasites, and but the thing is with parasites, it's definitely not perfect. I mean, there's no perfect test out there with really any of the tests we discussed, but it does get tricky, because if someone is negative for parasites, it doesn't always rule out parasites. And that's why there are
Right.
some practitioners, including some that I've interviewed, who don't do stool testing for parasites. They'll just treat for parasites. And there's definitely controversy over that. But obviously, if you see a parasite, if someone tests positive for like Blastocystis hominis, then it's, at least nice that that you have it. And then, again, you could choose to retest if you want to retest. And yeah, Tracy mentioned some other markers like, she mentioned calprotectin, which is an inflammatory marker, especially if someone has like ulcerative colitis, it's type of inflammatory bowel disease. Well, a lot of times see that elevated. Pancreatic elastase is another marker that we see on this test. And those markers, calprotectin, pancreatic elastase, we see those on usually other comprehensive stool panels. And again, we probably should differentiate. Maybe I'll have you do this, like difference between comprehensive and like going to a regular lab.
Right.
But before you do that, you mentioned zonulin, which is a leaky gut marker. If
Yes.
you test for zonulin, and if it's elevated, then it typically confirms that you have that increase in intestinal permeability, and which is the medical term for a leaky gut. The thing is, I usually don't recommend that as because it is an add-on test,
Right.
and again, I just see false negatives a lot with that. So it's not a perfect marker. If someone wants to absolutely do it, that's fine. But I just assume that most of the people we're working with have a leaky gut. So yeah, that's why, I used to do a lot of leaky gut testing using Cyrex Labs, the array number 2. And there's other tests like lactulose mannitol tests. But yeah, just myself and a lot of practitioners I know, they just assume people have a leaky gut. Again, there's so many different tests that you kind of have to prioritize it. Some people want to do everything, but most people have a budget, so they can't do
Yeah.
every test. Yeah, and the flaws with the leaky gut testing, it doesn't tell you what's causing the leaky gut. But obviously, if you're doing zonulin as part of the GI map portion of it, the rest of it, can tell you what might be causing that leaky gut. And again, what potential triggers like H. pylori could be a trigger for Graves and Hashimoto's. Parasites as well could be a potential trigger. And
Right.
yeah, if you want to, I mean, you could feel free to expand on anything I just mentioned, but do you want to briefly mention like what's the difference if someone just wants to get a stool panel from like a regular lab, like a LabCorp or Quest Diagnostics or anywhere else? What's the difference between this and the test
Yeah.
we're discussing?
Well, first, I would say about the leaky gut is we assume that everybody has one because they have an inflammatory disease, and if you're inflamed, your entire body is inflamed from your blood vessels to your heart to everything. So it's going to, as I always tell our patients, like if you have an inflammatory disease, you have an immune disease, where part of why we're assuming it, and you may agree or disagree on that, is that we're treating you with an inflammation. It's also with the food testing, as I mentioned, like you're irritated, so everything is going to irritate you. It's like being locked in a closet with somebody who irritates you particularly well and you're not getting out. They may not make it out, but part of it is just that, you're in a heightened state of inflammation. So we're treating it as thus. And then there's another marker that I've recently started looking more at, the methylbacterial marker that we see sometimes elevated in people with SIBO, because even though you can't get into your small intestine, either way, when people have a really bad, I've noticed that we've started to see that more when it's coming down into the marker. And I don't know, I don't know how you feel about that because I didn't ask you how you felt about that, but I've noticed we've seen more of it, and those people tend to test when they do SIBO tests. They're testing on SIBO. So I threw you under the bus there. Sorry about that. With the methylation markers that we're seeing in the large intestine, I tend to think of people having more SIBO with Graves and thyroid issues because they're off because of our SAD diet. But I'll talk about the comprehensive stool panel. I digress. If you go to LabCorp and you go to those others, the stool panel is just, collecting, and they're testing small amount of markers, what they're seeing, what they're picking up. They're not doing the full DNA. They're not running it. They're not doing the PCR test. You're just like, it's basically like, what are they seeing here? Are they not seeing or not seeing parasites? They don't have the 3 different, I know with the GI map, they do both the DNA, then on parasites, they do a visual scan on most of them. So it's just less comprehensive. It's testing less things. It's looking at less markers. It's not running the full DNA on all of them. And I'll be honest, I think part of it is that the companies that specialize in this, well, in the beginning, they have larger data sets because they have a larger amount of people coming in. So they have more of a background and more of training on what they're doing versus a LabCorp or something. Not that I'm not saying that LabCorp isn't good. It is good. It's just not giving you the full Monty, the full amount for it, for what you're getting. So it's just limited. And I think if you're going to pay for a test, you might as well get the whole test. And I'm not sure I explained that exactly the way that you wanted to explain with my digression, but I'm sure you'll fill me in on it.
Yeah, no, I agree. I agree what you said. And I mean, there's a time and place for, a basic stool panel. If someone is having, a lot of like diarrhea, for example, I
Right.
mean, you could always go, especially if it's covered by insurance, you could go to let's say your primary care doctor and, get that test because that's what it's testing for. It's testing for,
Mhm.
like, if you look at GI map, like a GI map report, really there's like 4 main pages to the GI map, and that's looking the basic stool panels, looking what's on page 1 of the GI map, which are
Right.
parasites, bacteria, and viruses that cause gastroenteritis and commonly diarrhea. So again, if you're having like chronic diarrhea, experiencing it for a number of days, then it's not a bad idea to go and get that test. Arguably, maybe even better idea than to get a GI map, because the GI map, it will take some time to get the report back. So
Yeah.
you might want to go for that basic test. But we're as far as like looking for triggers and like parasites, it's definitely flawed with that. It's going to again look at maybe a few parasites that relate to diarrhea, but if you're like relying on that to look at parasites, you're going to be missing out. And same thing with, again, I mentioned even with GI map or Genova
Right.
Diagnostics, other comprehensive stool panels. Also, those are not perfect for parasites, but
Yes.
arguably the one that you get through like a regular lab is going to be, even, just the bare basics, as Tracy mentioned.
Exactly.
And I want to expand. You mentioned SIBO, as far as small intestinal bacteria overgrowth. So of course the comprehensive stool panel, it's more of a large. It's looking at the
Yeah.
large intestine. Now, yeah, there are like markers, like some of the opportunistic bacteria. That if they're high, it might give like a hint that maybe like
Right.
someone might have SIBO, but I still would recommend, like, if I'm highly suspecting SIBO, typically I would recommend as the breath test,
Of course.
the SIBO breath test, and that's specific for the small intestine and looking, at the methane and the hydrogen. And, now there's a lab. I think there's just one lab that looks at like hydrogen sulfide as well. But yeah, so, but the good point as far as, that you could maybe get an idea of if someone has SIBO, but really not, again,
Right. Right. It's
yeah,
not perfect, but sometimes if it's really raging, the patient knows, but we could, there's a few markers that we see down there that occasionally tip us off. So it's just a, little added bonus there.
yeah, no, thanks for mentioning that. And so organic acids testing. So let's talk a little bit about that. And there's a few companies that do that. We use more commonly Great Plains Laboratory,
Right.
but Genova also has one called the Organics. That's pretty good as well. So let's yeah. Why
Right.
don't you
And
talk
then the
about
Dutch also has like an oat addition too.
exactly. We mentioned, yeah, it has like a brief, yeah, some organic acid markers on the Dutch too. So yeah, let's talk about the one again. Let's get into the Great Plains one, since that's the one that we mainly do in the practice.
Okay, sure. This is another urine test, so it's easy. And, again, you'll probably want to also be a little slightly dehydrated because we want to count, concentrate the urine so that we can catch it. It does 74 markers. It's at home. Again, like I can keep saying about some of the tests, it's an easier test because you're at home or at work, and you could do the collecting. So it does 74 markers from organic acids. And they are what your body produces and metabolizes when you're eating food. So and then discarded. And by measuring the amounts of them, we could see, if there's pathway clearing, your kidney function, too much, too little, cellular metabolism. Some gut microbiomes are in it. Now, the limitation is that it's showing us what you've eaten or what you've done within a 12 to 48 hour time period. When we're all going to the doctor, we're going to be really good before our blood work and everything like that. So my tip to patients is I really want you to eat what you normally eat. Do not try to game the test. Don't try to, clean up your diet beforehand, because the purpose of this is for us to see what you're doing all the time, not on your best behavior, because then we can really help you and we can really find your triggers and, some other things going on by behaving in a normal manner. So that's a good thing to keep in mind. If you're digging, don't do it around the holidays when you're eating the cookies and everything. Maybe just do it during your normal diet. So it is important what you eat beforehand, and I want you to eat what you normally eat. One of the best things that we do like about this test is yeast overgrowth is seen in this test, and it shows some of that. So it's a good highlight on that versus seeing it not necessarily in the GI map or something else like that. It shows vitamin deficiencies on a neurotransmitter level, mold, fungus exposure to a certain extent. You're like other food, like other tests, like the coffee and the avocado, the avocados for one test, you're going to avoid certain foods for this one. So you'll want to look up that list. So even if it's in your normal diet. And like I said, it's a quick and easy snapshot of your cellular health. High oxalates are good to know. Some patients are impacted on it. I know that Eric, you had a high oxalate marker when you first were testing, and you did some remediation. It also indicates your detoxification, if what your body's doing, and your mitochondrial markers. So this is another good snapshot of your health, but it's limited. It's the 12 to 48 hours of that. So there you go. A trigger, again, I mentioned yeast. Part of it is mitochondrial dysfunction we may see there on some triggers. So every test has a little bit of a piece to the puzzle for what your triggers may be.
Yeah, organic acid test, again, a really good test. So Tracy mentioned yeast overgrowth. And yeah, the stool test, look for yeast. It just doesn't show up a lot of times. If it shows up on the stool test, then you probably have a real bad case of yeast overgrowth. So I do prefer the organic acids test if we're going to look for Candida overgrowth or other types of yeast. It's not just Candida. And then she mentioned mold markers. And so it could give an idea if someone has, like Aspergillus. It's not
Right.
a comprehensive mold test. Actually, Great Plains has their mycotox test, which,
Yes.
is more comprehensive. So if someone wants to look into mold, there's also real-time labs and a few other labs that look into mold tests. And the two of the more common ones are Great Plains labs and real-time laboratories. And yeah, Tracy mentioned looks at some mitochondrial markers, which could be a factor, not just with autoimmunity, but yeah, like other, really anybody could have mitochondrial issues. And she mentioned yeast potentially being a trigger, or even if it's not a direct trigger, affecting that permeability of the gut. And mold also could be a trigger, which we mentioned. And it looks at some of the neurotransmitter markers. She mentioned oxalates, and yeah. So when I did I did this test a couple of times. The first time didn't look too bad. I did have a little bit of yeast overgrowth as well, a little bit of Candida, but then I did have the high oxalates. And at the time, I was adding spinach regularly to my smoothies, and then so I cut out. That's the main change I made, was cutting out the spinach. I was eating other sources of oxalates, but I can't say I really made dramatic changes in the other areas. But when I retested, the oxalates were normal. So it was really, in my case, the spinach that was the main culprit. But there could be other higher oxalate foods like Swiss chard and sweet potatoes and even nuts and dark chocolate. Again, it's going to be really difficult to completely eliminate the oxalate. So we don't recommend trying to do that. But the spinach is probably the highest source of oxalates. And even if you cook the spinach, it doesn't really, it doesn't have much of an impact. And also, she mentions some nutrient indicators. So it looks at some of the B vitamins, looks at CoQ10, and looks at NAC, N-acetylcysteine, and then some indicators of detoxification as well. And so, yeah, I mean, really, to me, this is it could find triggers, but also it's a good overall test, just looking at different areas. Like, whereas some of the tests we spoke about so far, especially like saliva testing, looking at focusing more on adrenals and Dutch adrenals and sex hormones, stool test, of course, looking at the gut. Here, this is looking at like different areas. So it's more of a broad test. I mean, this would actually be a really nice screen for like going to like through a physical. I mean, it probably will never happen, but you go to a physical and, they of course just usually do like a CBC, metabolic panel, lipid panel. And, that's pretty much it. I mean, they might do a vitamin D, but, this actually would be a real neat test, to do as part of a physical and just to see like one's overall picture there, yeast
Right.
overgrowth, looks at Clostridia. We didn't mention Clostridia, but that could also be a factor. The oxalates, the mitochondria, the neurotransmitters, the nutrients, indicators of detoxification. So again, it's a, really neat test. Like the Dutch test, also a urine test, so pretty easy to collect. And yeah, so again, can't say enough good things about this test. And Genova's test is pretty good too. I don't think that, at least as of now, I don't think they test for oxalates. I think Great
No.
Plains Lab is the only one I know of that tests for oxalates. And then same with Clostridia. I mentioned Clostridia, which stool tests will look at Clostridia, but they don't
Yes.
differentiate between, like potentially harmful
Right.
strains of Clostridia and
Yes.
commensal, whereas the organic acids test from Great Plains is, looking at more of the problematic Clostridia. So if you're
Yes.
high in the Clostridia, you definitely want to address that.
Exactly. Yeah. Mhm.
All right. Well, I think we covered, I mean, for the most part, we covered what I wanted to. I guess the one thing that I'll briefly mention is, because you mentioned the mediator release testing, the food sensitivity testing. And, I actually have another interview. I've spoken about it in the past with some practitioners. And then there's a follow-up interview with Elizabeth Yarnell, who I interviewed previously. And she has a new book coming out. So she's actually going to talk more about, the MRT. But yeah, the media release testing, I do like it. I need to probably do more of it. I've just had such I I can't say opposed to food sensitivity testing, but in the past there, I was more familiar with the IgG testing and just
Right.
didn't find that to be too reliable. Like Tracy said, if someone has a leaky gut, a lot of times you'll get a lot of foods being positive, which is related to the leaky gut. And then it's a little bit of a challenge because, again, a lot of those foods may be healthy foods and foods that are allowed on an
Right.
AIP or paleo diet. And so, yeah, just, again, I can't say I never did IgG testing. And, I've done it in the past, but it usually wasn't the first thing I would recommend. Usually if someone wasn't progressing, then I would like go to the food sensitivity testing and initially just rely on the elimination diet. But I've heard so many good things about MRT, and again, I've dabbled with it, had some patients do it, but just not, not nearly enough. And, after interviewing Reed Davis and, again, Elizabeth Yarnell and a few others, it's just something that also could be very valuable. It's just that everything does add up. And so you need to just
It
prioritize
does.
and say, well, this is the test. And also, I've had success without the MRT over the years, but, again, obviously always looking to get, even better outcomes that I do now and, potentially get people better even quicker. So yeah, that's definitely something else to consider. And
Yeah. No, I agree with you. I dislike the IgG test because I just found that when you're in a state, you're in a state, and it came back with numerous things that weren't allergies, that were just not, that were just sensitivities and other things. And I had to do the MRT test for taking my course, and I don't have food allergies or sensitivities. I'm sort of like the goat of the family. And a couple of my kids are allergic to two different things and have severe EpiPen type of allergies to them. And I found that that was the most accurate test of them because it didn't come back giving me a list of things that the other test came back listing. And I'm not downing it for other people. It's been a game changer, but it was interesting for me to do it because I already knew that I wasn't sensitive. I already spend a lot of time working on my health because it's my job. And but I was pleased to see that it did not come back with a lot of false positives and a lot of false, things that like, oh my God, I can't eat anything. I'm already doing an AIP diet. So I appreciated that about the test, and it sort of turned my view of it. My youngest is allergic to pecans, and it actually picked it up on one test. And then as an experiment, because I do love to experiment, I'm like, oh, let's do the IgG test. And that didn't pick it And it's an EpiPen sort of situation. So it was interesting to see. So I guess we'll be doing more in the future when we need to, because we don't need to do them so often. So
Yeah, well, if I will say, if it's a true allergy, like if you had a
yeah,
pecan allergy, the
yeah.
IgG wouldn't pick it up, because usually
No, it doesn't.
that's an IgE mediated
Right,
response. So
right.
yeah, so looking for something different. But yeah, I mean the IgG, again, some labs are better than others, but
Yeah.
still I do like the MRT better. And
And again, I
so
like to say we're in an inflamed state. So when you get those sensitivities, sometimes, as I think in Reed's interview, I think he's coming after me, he mentioned that he gets an updated list, because when we're in an inflamed immune state, sometimes things change because our bodies change. So it may be that you're more sensitive or you're more reactive. I tell people, as they get healthier and as they eliminate things all the time, what's fabulous about it is at one point you're in a crowded room, because our whole diet, our sad diet before we change it, is just a crowded room of unhealthy things and environmental toxins. And once you clear out that little voice that used to bother you, gluten or milk or whatever it is that used to never bothered you before, is now being able to be heard. So that's a beauty of I guess, my plug for eating healthy and getting healthier, is that those quiet voices that we can't hear, that our body's telling us, because we're so unhealthy and so living in such a toxic environment, we can now hear. So it's a good thing.
yeah, I agree. And yeah, anything else? Any last words before we wrap this up, Tracy? You did great.
Well,
Again, definitely. I think we both, went into great detail with the test,
yeah.
but just want to make sure there's nothing else that you wanted to add.
No, I think it's good. I look forward to seeing new patients and reading their tests and doing new programs and just continuing before. I love what I do. So I always joke that there'll be a skeleton here in this chair by the time I'm done, because I just love it. So I'm clearly dedicated. Our whole office is. We love what we do. So I look forward to the future.
Yeah, which of course is important. You want to work with someone who enjoys doing what they're
Yeah.
doing. And yeah, Tracy definitely is very passionate about what she does.
I think I
And
was emailing you on my vacation for my anniversary on something I was reading about an update. So yeah, I do love what I do.
yeah, so every time I do an interview, I usually share the website of the person I'm interviewing. But of course, in this case,
Your
the
website.
website is naturalendocrinesolutions.com. And, Tracy's also active in my Graves' disease and Hashimoto's Natural Solution support group on Facebook. So you definitely could check that out. I don't know if you're on Instagram, if you have, an Instagram account that you want
I
people
do
to follow
not.
you. Okay. Oh, okay. I
Yeah.
thought I was the only one that wasn't on Instagram.
No, it's the two of us. I could barely keep up with the Facebook group, but join the group and join the programs and do all the stuff that we're doing. So it's a fabulous group of individuals who contribute and research and do stuff. So that's a nice resource for everybody, along with the podcast.
Yeah, definitely check out the podcast. And yeah, again, thank you so much for this interview,
Thank
Tracy. It was
you.
a pleasure chatting with you. And I'm sure the listeners learned a lot about testing and the different triggers that go along with the test.
Well, thank you for having me.